Good morning. I am Dr. Devan, Director Surgical Oncology, Rajiv Gandhi Cancer Institute, Delhi. Today we are going to talk about what causes mouth cancer or oral cancer. So let me tell you what is mouth cancer, why it is important to know about mouth cancer and what causes mouth cancer. Why it is important to know about mouth cancer. You see, whenever we treat mouth cancer, especially we do the surgery, aesthetics are involved. Everybody is concerned about scars on face, neck, and the public appearance. And so much so, person can have drooling of saliva. He can't eat in public, and even amongst their own family members. There could be dry mouth. You might have seen patients carrying water bottles. They are actually suffering from post-radiation effects of oral cancer. The food habits get changed. Their speech is altered. There are psychological effects. The effect on sexual life is there. There are issues, interpersonal relationship issues. There is discrimination in jobs. Nobody wants to keep them in job. There are insurance issues. And there is a lot of social stigma attached to it. Physical and mental trauma, of course. There is financial loss, and there are spiritual issues. So hence, head and neck cancers are unique. So what is mouth cancer? Today we are going to talk about mouth cancer. Mouth cancer includes your lip, your gums, cheeks. Behind the cheek area, behind the teeth area is called retromolar trigone. Tongue, under surface of tongue, we call it as floor of mouth, and hard palate, talu area. Tonsil is not a part of oral cavity. Your throat is not a part of your oral cavity. But rest of the things which I named are oral cavity parts. Now the question is, what causes mouth cancer? India is the hub of oral cancer in the world, and it is a man-made disease, man-made disaster, and it is not genetic. And the main factors involved in causation of oral cancers are tobacco chewing, smoking, alcohol, dietary factors, chronic irritation with bad teeth or dentures, some of the viral infections, and poor hygiene. WHO estimates that annually nearly 5 million people are killed by tobacco-related illnesses. And by 2030, 8 million deaths will occur each year. And 2,500 persons die every day due to tobacco-related diseases in India alone. And in India, about 275 million tobacco users are there. That is 27 crore Indians use tobacco in some or the other form. And what does tobacco contain? It contains more than 4,000 chemicals, of which 50 of them are known to be cancer-producing substances. We call them as carcinogens. Some of the carcinogens, I can name them as acrolein, PAH, TSNA, even ammonia, arsenic, carbon monoxide, hydrogen cyanide, naphthalene, nicotine. Some of the radioactive compounds are also there in tobacco. It not only causes cancer, but it affects your cardiovascular system, causes coronary artery disease, means heart attacks, hypertension, cholesterol disorders, bronchitis, chest infection. Pregnant women who smoke have low birth weights, premature babies, and chronic infections in children are very common if parents are smoking. Smoking, actually, tobacco can affect skin, tooth, fertility, ear, eye, bone, every organ of your body can be affected. So tobacco chewing, what does it do? It produces white or reddish patches in your mouth. It is called leukoplakia, erythroplakia, and some people cannot even open their mouth. It is limited to maybe 1 finger, 2 finger. It is called submucous fibrosis. It is because of the supari or gutka which you chew, and you think that is a food product. Is more harmful than tobacco. And there is, of course, in addition to cancer, there is effect on your gum and teeth. So how does smoking affect you? Smoking has two components. One is nicotine, the other is the harmful chemicals or carcinogens which are causing cancer. What does nicotine do? As soon as you take a puff, within 10 seconds, the nicotine reaches your brain and it stimulates your brain and releases two substances. One is dopamine and you feel good. The other is noradrenaline, which makes you alert and energetic. That is why you must have seen children during exam days, they smoke and smoke a lot. They think they are feeling good, they are feeling energetic, but actually your body gets drained. So the biggest culprit is tobacco. And the message to smokers is 1/4 will get killed in their middle age. That is 35 to 65 years age, losing many years of their life. Each cigarette cuts 11 minutes of your life. And there is one word about second-hand smoke. You smoke one cigarette as a non-smoker. If your father smokes 10 cigarettes a day, means 10% of the smoke goes in your body, you inhale even if you're not smoker. And alcohol consumption, it is equally bad. It is associated with mouth cancer, throat cancer, voice box cancer, and even other non-head and neck cancers like liver, breast, lung. And alcohol and tobacco is a deadly combination. If you look at diet and cancer, diet which is low in fruits and vegetable has been implicated in cancer of mouth, voice box cancers, and esophageal cancers. Even iron deficiency anemia has been associated with something like Plummer-Vinson syndrome. There is dysphagia, means difficulty in swallowing, and people tend to develop throat cancer, especially females. There are some viral infections which are associated with actually throat infection, but some of the oral cancers are also associated with viral infections like HPV, but they are associated more often with tonsil cancer, but we have seen with even oral cancers. Nasopharyngeal cancers associated with Epstein-Barr virus, and AIDS patients are more prone to develop cancers. And then bad oral hygiene, sharp teeth, poorly ill-fitting dentures, they can cause cancer by constant rubbing. So again, I am repeating, aswachhata, asabhyata, both are associated with oral cancer. Cancer is not inherited, but it is a man-made disaster. Thank you.